Hi, I'm Rachel Rubin, one of the co-creators of Rise Gatherings, retreat experiences for women, and this is Rise TV. We are here with the wonderful Lauren Hauser, Integrative Functional Nurse Practitioner. I am delighted to be sitting here to have the conversation with you about optimizing your health. Me personally, I haven't seen you, even though I have this kind of really desire to, but I don't really have any presenting symptoms. I feel pretty healthy. I take care of myself well enough. You know, I'm 34, so I know that I want to continue to give the attention to my body on a level that I can't see.
Sure.
So maybe you could tell us why people would come to see you even if they're not having a presenting symptom.
Sure. And I think that's a great question. And I find that my patient population is a bit divided. You know, half of the people that I see are struggling with symptoms or have a chronic disease or illness they want to work on or address. But I also see a lot of people that just want to optimize. They want to prevent. They have a family history of dementia or of cardiovascular disease, and they want to know specifically what they should be doing to move forward and live not only long, but with a quality of life. I start all my new patient appointments with, what are your health goals? And then kind of really do some in-depth testing often to see if there might be things going on that are before you have symptoms.
And that's what I feel would be empowering. That's really what's been drawing me to want to come see you, is to have some of those tests that would give me more information about my chemical composition in my body. These are things that we don't have the ability on our own to measure or know without these kind of tests, and that they can give us direction.
I think that's one of the most valuable things, is that it's a personal look at what's going on with you. It's not just, we know we should sleep more, we know we should exercise, we know we should eat more vegetables, but specifically what's going on in your body or what are your needs versus someone else's, and how do I guide you so that you're making those choices that are best for your needs. And what that does is it allows accountability. When you kind of look at testing that's yours and you say, oh, you know, I'm low in B vitamins, I really do need to get those leafy greens in. It's an easier decision in the morning to throw them in your smoothie.
Yes.
Knowledge can be very powerful.
Right.
And I think that's the value I see in doing some of these testing.
If you were to give one piece of wisdom to anyone who's watching to optimize their own personal health, like, what would that be?
There's 4 pillars that I always say are foundational to an integrative approach. I usually talk about supplements and nutrients and vitamins because as much as we can eat well, our soil's depleted and it's hard to
take none. By the way,
which is
just
totally
telling
fine.
you all of that
which is
here.
Totally fine. I take very minimal as well.
Okay.
But it's because
I'm
I know
curious
what
of what I
need.
should take, though. You know,
My goal is never for you to walk out with fistfuls of supplements. My goal is for you to get your nutrients from your food. But oftentimes we need to help balance that out a little bit. And then I always talk about nutrition. And that it's different for everybody. Everyone's not going to walk away doing a gluten-free elimination diet, no sugar. Sometimes it's as simple as, you know what, Rachel, I think you really need to get more protein in your diet. You know, I'm looking at your albumin, I'm looking at some of your markers. It's suggesting you could use some more protein. And then I always talk about exercise. So exercise for me is not about weight loss. It's about mental health, also cardiovascular and cognitive prevention. I always talk about my body. So I think that's where I really love my connection with Rise, is that you both are such big proponents in teaching women how to connect on a mind-body level. And I think that's so valuable and underestimated for our wellness.
The last one is the one that really almost supports our ability to be in relationship with any of those things.
And there's a couple of reasons why, and this is science, evidence-based. Our autonomic nervous system has 2 branches, so sympathetic and parasympathetic.
These are my favorite. You're going, okay.
So sympathetic is what we're all familiar with. That's fight or flight. That's when our blood is diverted away from our gut and reproductive organs. It goes to our heart and our brain and our muscles, and it's a chemical reaction. And it is the same whether there is a tiger in this room or whether you're stuck in traffic. And it's a necessary reaction. You know, if there's a car coming at us, we need to jump away so we don't get hit. The problem is we live in a world now where we're in this constant state of sympathetic stimulation. The opposite of that is parasympathetic state. So this is rest, digest, reproduce, and heal. So our body's equipped with a whole system to heal itself. But when we're in a sympathetic state, it's much harder to do that.
I really appreciate you acknowledging that, because I think that it's a simple understanding of our body that most of us don't really have or haven't been taught. Yeah. And as far as functioning in adulthood, it's if we can become aware of that, if we're active and doing, we're in this one state that is kind of taking more of us. Yeah. But if we're calm and resting, our body is in the state of being able to restore itself.
It's restorative, exactly.
Right, because our bodies, they're brilliant. They're much smarter than we are.
I totally agree. And the cool thing is that mind-body practices, the science, the evidence-based shows that we can actually shift states. And in doing so, we rewire our brains. It's called neuroplasticity. So we actually make new connections in our brains, which is, one, so cool, but also really powerful in how we feel. And it can be a breathing exercise. It can be listening to one of those great apps on your phone. Anything that stimulates that parasympathetic response works just as well.
Thank you again, Lauren, for joining us here.
Thank you for having me.
If you want to learn more from Lauren, which I do, you can come to the Rise Gatherings weekend in 2020 and be with us there. And also, Lauren, can you tell the viewers how they can work with you?
Sure. So I have a practice in Buckingham, PA, in Bucks County, and my website is centralbucksim.com.
Wonderful.
Thank you.
Thanks for being with us for another episode of Rise TV.